Hi guys, this is a video tutorial for the humerus of the human body. The first structure to pay attention on the humerus is of course the head of the humerus, which is this structure here. This is known as the head of the humerus. Now, you need to pay attention that there are two necks on the humerus. The first neck is the anatomical neck of the humerus, which is this region here. So this is known as the anatomical neck of the humerus. The other neck that exists in the humerus is this neck here, and this is known as the surgical neck of the humerus. Now we can pay attention to the trochanters. I'm going to rotate this structure, and you're gonna see two bumps on the humerus, and these are the tubercles. So the lower one is known as the lesser tubercle. And the top one is of course the greater tubercle. Very similar to trochanters, and trochanters are in the femur. We have the greater trochanter and lesser trochanter, very similar to that bone. Now if you follow through with each tubercle, you're gonna see the crest of the tubercle. So this region here is the crest of greater tubercle. And of course the other one is the crest of the lesser tubercle. And if you pay attention, the middle region between both tubercle is the intertubercular sulcus. This is known as the intertubercular sulcus. And now we can move down a bit, and you can see the deltoid tuberosity, which is right about here, and this is where the deltoid muscle attaches to the humerus. Now we can go down to the condylar region. So before talking about that, I like to cut the structure in this way. And we can see there are two holes here. Okay. So, and remember, this is towards the middle of the body, this region here. This region here is known as the medial supracondylar ridge. And of course, this one is the lateral supracondylar ridge. Now we can talk about the condyles. There are the medial condyle, which is this guy here, medial condyle, and right below it, this guy here, you got the medial epicondyle. And you know, the other side mirrors this exact same thing, but now since we're away from the center of the body, you got the lateral condyle and the lateral epicondyle right here. And before we go into the next structure, I'd like to review this real quick. This structure again was the medial supracondylar ridge. This structure mirrors that. Right below it, you got the medial condyle. Of course, on the other side, you got the lateral condyle. Right below it, you got the medial epicondyle, and the other side is the lateral epicondyle. Now, let me clean this up. Now you can see there are two holes here. Not holes, but like more of a structure that's here. And this is known as the radial fossa. And this structure is the coronoid. The coronoid fossa. Coronoid fossa and radial fossa. Now you can see this bump here, and this guy here is known as the capitulum. Capitulum. And right next to it we have the trochlea, and trochlea extends all the way back to the other side. As I will rotate the structure in a sec, but again, this is known as the coronoid fossa, this guy here, and this is known as the radial fossa, capitulum, and trochlea. Now, this is the interior view, so let's rotate the structure and look at the posterior view of our humerus. And as I mentioned, I hope you guys can see that the trochlea, which was this structure here, extends all the way back. Capitulum ends in the front, but trochlea goes all the way back to the posterior view. So this is trochlea. And this structure here is then known as the olecranon fossa. Olecranon fossa. When we talk about the hand tutorial, the ulnar radius, you're gonna see the actual olecranon bone. Thanks for watching.